This is our lecture on urinalysis. We have a lot to talk about when it comes to this topic, so we'll get started here. The composition of urine. So urine is mostly water, 95%, and then waste products is 5%. Urea and electrolytes are some of those waste products. Polyuria. So polyuria is an excessive increase in urine output. It can be caused by excessive water intake, diabetes, diuretics, and caffeine. One of the symptoms of diabetes is polyuria. And diuretics, that's a medication that causes, that helps the body get rid of extra fluid. It's often given in patients who have congestive heart failure or high blood pressure. So that causes the patient to void a lot. Oliguria is a decreased amount of urine output. It's usually defined as less than 400 mLs of urine in 24 hours. Dehydration can cause that, as well as kidney disease. So let's look at some terms related to the urinary system. So anuria is failure of the kidneys to produce urine. So a lot of dialysis patients have anuria. Diuresis, that's what happens with diuretics. It's the secretion and passage of large amounts of urine. So patients who take diuretics often go through diuresis. Dysuria, that's difficult or painful urination. We often see that with a urinary tract infection. Frequency is the condition of having to urinate often. That can also be a symptom of a UTI. Hematuria is when blood is present in the urine. Nocturia is when you have excessive urination during the night, but it's voluntary. Nocturnal enuresis is the inability to control your urination during sleep or bedwetting. Pyuria is when there's pus present in the urine. Retention is the inability of the bladder to empty. Urgency is when you have to urinate right now. And then urinary incontinence is the inability to retain urine. So the guidelines for urine collection, you want to make sure that you obtain an adequate volume, usually 30 to 50 mLs, and your specimen containers are calibrated so you know exactly how much that is. Again, you want to make sure you properly label each specimen to avoid any mix-up of specimens or containers, and you want to record medications the patient is taking on that laboratory requisition if needed. Excuse me. You also want to try not to collect a specimen during menstruation because it can contaminate the specimen with blood, giving a false positive result. So the type of specimen being performed often dictates the collection method. If you're going to get a random sample, there was no restriction on time or method. Patient comes into the office, they're having some symptoms of a urinary tract infection. So they're having dysuria where they're having burning, some urgency, some frequency. That would be a random sample. First voided morning specimen you might use during pregnancy because that is when those hormones are going to be most concentrated. We'll talk about that more. And then a clean catch midstream collection. You might do that more specifically for urinary tract infection. A random specimen is urine testing often performed on a freshly voided specimen. The medical assistant instructs the patient to void in a clean, dry, wide mouth container. So void, urinate is all the same as empty your bladder or RP, just to make sure everybody knows that. And then the urine is tested immediately. So when we talk about a first voided morning specimen, this contains the greatest concentration of dissolved substances. A small amount of a substance is detected more easily, and then you want to instruct the patient to collect that specimen in the morning and then store it in the refrigerator. You also want to make sure they have that container that they can put their specimen in. A clean catch is required when urine is examined for bacteria, and this is to prevent contamination of the specimen with normally present microorganisms. So it's ordered for detection of a UTI and to evaluate the effectiveness of drug therapy for a UTI. So when you do the clean catch procedure, you're going to use a sterile container. You're going to instruct the patient to cleanse their urinary meatus. And the purpose of that is to remove normal flora. So there's usually small wipes. They're Castile soap wipes. And the patient is instructed to cleanse front to back, usually 3 times. They void a small amount into the toilet, stop, and then finish providing a specimen into the cup. This is again so that normal flora can be removed and that contamination is prevented. So after that's collected, the medical assistant should immediately cap the container and label it. You want to test the specimen right away or refrigerate it, whichever is going to happen there. And then you want to make sure that you have the lab request if it's going to an outside lab, and document whatever is needed in the patient chart. So 24-hour urine specimen. So this is greater accuracy of measurement than with a random specimen. So some examples of substances that might be measured during a 24-hour urine collection are calcium, lead, protein, creatinine, potassium, and urea nitrogen. So this is often used to diagnose the cause of stone formation. And it's a large container that's used, usually 3,000 mLs. So if we think about a 2-liter bottle of soda is 2,000 mLs. It's a pretty big container. It's 3 liters. And it must be kept on ice or refrigerated. The patient is also provided with a container to collect their specimen that can be used to pour the urine into a larger container. So a male might use a urinal. A female we might give a hat to. So a hat is just something that sits into the stool, and the female can void into that container and then dump it into the larger container. The physician may want to discontinue certain medications a week before. So you want to make sure that you're providing the patient with both written and verbal instructions. They need to drink a normal amount of fluid, avoid alcohol 24 hours before and then during collection. They want to do it at a time when they can be home for that full 24 hours. So you don't want to be transporting it back and forth somewhere. And then females do not want to do that during menstruation. So a urinalysis. A urinalysis is an analysis of urine that consists of physical, chemical, and microscopic exam. So this is we usually perform urinalysis on a fresh or preserved specimen. If the specimen cannot be examined within 1 hour of voiding, you want to preserve that immediately in the refrigerator. Before testing, you want to make sure you return it to room temperature and thoroughly mix your specimen. So just rotate the urine around in the container a little bit. Changes that can take place if a specimen stands out for more than 1 hour is that bacteria in the environment that get into the specimen, they work on urea, which is very acidic, and it converts it to ammonia, which is alkaline. So that changes the pH of urine. Acid urine becomes more alkaline, which results in false positive results on a protein test. Also, bacteria multiply, which makes the specimen cloudy. It increases the nitrites that are present. If glucose is present in the specimen, the amount decreases because microorganisms use glucose for food. And then if any red or white blood cells are present, they can break down as the specimen sits. Okay, so when we look at the color of urine, the color ranges from almost colorless to a dark yellow. If urine is more dilute, it's going to be lighter in color. If it's more concentrated, it's going to be darker. And the color is due to the yellow pigment is urochrome, which is breakdown from hemoglobin. Remember, hemoglobin are those red blood cells that carry our oxygen around. So you might use light yellow to dark amber. Amber is probably we used to use tea colored. So amber is probably a better description of that. When you look at the appearance of fresh urine, it's usually clear to transparent, and it just becomes more cloudy if it stands out too long. If it's cloudy in a freshly voided specimen, that can be the presence of bacteria, pus, blood, fat, yeast, sperm, mucus threads, or fecal contaminants. And the classifications used to describe the appearance of urine can be clear, slightly cloudy, cloudy, or very cloudy. Specific gravity. So specific gravity indicates the amount of dissolved substances present in the urine. It provides information on the ability of the kidney to dilute or concentrate urine. So the normal range is 1.003 to 1.030. You can see a decrease in specific gravity. You see that a lot in chronic renal insufficiency. You don't see diabetes insipidus very much. You might have an increase in specific gravity if someone's dehydrated, if they have congestive heart failure or liver disease. You measure specific gravity by a reagent strip. So the strip is dipped into the urine, and then you use a color comparison chart to determine the level of specific gravity. So chemical tests that are routinely performed. So usually we find out about pH, which tells if the urine is acidic, so it's less than 7, or if it's alkaline, which is over 7. Neutral is 7. Protein is not normally present in the urine, so that can indicate proteinuria is commonly caused by bacteria or a kidney problem. Glucose is also not normally present. Glucoseuria can be commonly caused by diabetes, especially in those who are not controlled. Ketones aren't normally present. Ketonuria is commonly caused by starvation or uncontrolled diabetes. Patients are really uncontrolled if they start having ketones in their urine. Blood is not normally present. Hematuria can be an infection of the bladder or kidney, can also be an indication of a tumor. Bilirubin is, that's what gives urine its yellow color. If you see excess of this, that can be in liver disease. Urobilirubin is normal, but excess can indicate liver disease or mononucleosis or mono. Nitrite is not normally present. Usually we see that in some type of UTI or bacterial infection. Leukocytes can be normal just because that can be part of our normal flora, but in excess can be due to a kidney or bladder infection. Urine pregnancy tests. So, the purpose is, of course, to determine if a woman is pregnant, or for diagnostic purposes, to prevent medications being given during procedures that are performed that may cause harm to the fetus. So sometimes if a patient's going to have surgery and there's concern that she might be pregnant, they might want to do a pregnancy test just to make sure that she's not, so they're not harming the fetus. Immunoassay tests are often used in the office, and that just detects the presence of the hormone HCG, human chorionic gonadotropin. A concentrated urine specimen is required. That's that first voided morning urine. HCG is produced by a developing fertilized egg, and it secretes into the blood and to the urine. It can detect pregnancy as early as 6 days before the missed period, but most often can be detected on date of missed period, so on the first day. These immunoassay tests are usually 99% accurate, and instructions for interpreting those results are in the product insert. So guidelines for urine pregnancy testing. We want to make sure we use a clean disposable container. Again, first morning voided urine has the highest concentration. A random sample can be used. But one thing you really want to pay attention to is that specific gravity. If it's less than 1.007, it's too dilute to be tested. And that's the end of our slides. Let me go through some review with you. Make sure you remember what homeostasis is. Remember that you can use lab testing to determine, so if you do a strep test, you might do that for someone who you think either has strep or maybe pharyngitis. You're trying to figure things out. A lab directory doesn't include instructions for testing specimens. That's important to remember. Make sure you know fasting. If you were to talk about fasting, we said no food or drink except water. So if someone's fasting, they can at least have water. If someone is NPO or nothing by mouth, they can't have water. So that's the difference between fasting and NPO. You want to make sure you know about those in vivo properties and also examples of CeloWave tests. CeloWave, sorry. I think we covered most of this. Again, if a control, when you're doing quality controls, those are important to make sure that you're testing your analyzers or whatever your testing kits are working properly. So if that doesn't work, you don't want to use it on a patient. Make sure you know about qualitative versus quantitative. Polyuria, I think we talked about this, but you can see that with caffeine use. Remember that if you are culturing a urine, so if you're going to send a culture, you obtain when you want to know what type of bacteria is growing in the urine so that you can treat it appropriately, you will need a clean touch specimen for that. Also, I don't think I mentioned this. If you have a freshly voided urine and it's cloudy right when you get it, sometimes that can mean that improper technique was used. So maybe they didn't cleanse the urinary meatus like they were supposed to. Make sure you know alkaline and acidic for urine. I think we talked about ketonuria, but that's ketones in the urine. Remember that bilirubin can be in liver disease. Also, if you see blood in the urine, a lot of times, you think about that being normal just in women who are menstruating. And I think that's all the review I have for you. Thank you all very much for listening.